Hello, my name is Belinda Carpenter, and I will be doing an informative speech over diabetes. I work as a certified nurse's assistant in a hospital where I work with people that have diabetes all the time, and I get asked to check their blood sugars for them. So I need to know what is an abnormal blood sugar and what diabetes actually is. The definition for diabetes is it's a disease in which the body does not produce or properly use insulin. Insulin is a hormone that is needed to convert sugar, starches, and other food into energy needed for daily life. You may be wondering how this affects us. Well, the American Diabetes Association states that there are over 25.8 million children and adults in the United States that have diabetes. There are also 1.9 million new cases of diabetes diagnosed in people 20 years or older a year. In 2007, diabetes was listed as the underlying cause on 71,000 death certificates and was listed as a contributing factor on an additional 160,000 death certificates. This means that diabetes contributed to a total of 231,000 deaths. There are a few major types of diabetes that I'm going to be going over. Type 1 diabetes results from the body's failure to produce insulin. Type 2 results from insulin resistance. This is also the most common. Most Americans have type 2 diabetes. Gestational diabetes is diagnosed during pregnancy around the 28th week. And after pregnancy, about 5 to 10% of women will develop type 2 diabetes. Another type is prediabetes, and this occurs when a person's blood glucose levels are higher than normal, but not high enough to be considered type 2. There are 57 million Americans that have prediabetes. There are also many different types of complications that are associated with diabetes. Some of those are heart disease, stroke, high blood pressure, blindness, kidney disease, nervous system damage, and amputation of the limbs. A way to find out if you have diabetes is by doing a blood glucose test, and that's just you take a blood glucose monitor and you put a strip in it. You take a lancet before you sanitize your finger, take a lancet, prick it, and take the strip and put the blood in the strip. The monitor will measure how much glucose you have in your blood. And if it's the American Diabetes Association likes to see the levels up from about 70 to 130 milligrams a deciliter before meals and less than 180 after meals. There are a way to treat it. If let's say I'm walking into a patient's room and they have 100 or 200 blood sugar, I would then go tell my nurse, and my nurse would give them insulin, and usually that's through an IV, or they can give them medications if they need it to be regulated all the time. And there has been times when I've walked into a room and found that somebody's got a 40 blood sugar, and then in that case I would go tell the nurse again, and then they would instruct me, if the person was awake and oriented, to then give them either a juice to get their blood sugar working. And juice is actually pretty fast acting. It's got a lot of sugar in it, so I would have to recheck their blood sugar every 15 minutes until it was back to normal. Now, if the juice didn't work, I would have to probably give them another juice and then a carb to try to get them to sustain it. And that's what we've been doing. Now, if they're not responsive at all and just really out of it, which happens a lot if you have too much insulin, the nurse would inject dextrose, which is pretty much sugar water, in through the IV. There are a few methods that you can use to prevent diabetes. Of course, exercise and eating well, and then also looking into your family history, because it is hereditary, and if you are Hispanic or African American, you're more likely to get it. You're also more likely to get it if you're male. So it's a good idea to stay healthy, stay fit, and do the best you can do. And that would be my speech.